Wonderful. So our presenter today is Andrés Villaveces. I'm going to introduce him and then I'll just hand it over to you, Andrés. If I can. Oh shoot, I had your intro up a second ago. Gotta find it. Here we go. Andrés Villaveces is a physician and epidemiologist with over 25 years of experience researching injuries and violence prevention. He currently works at the CDC as a senior scientist in the Field Epidemiology and Prevention branch, leading the implementation of the Violence Against Children and Youth surveys, which is part of what we're going to be talking about today in Latin America. He has worked at the World Bank, Rand Corporation, University of North Carolina at Chapel Hill, the Geneva Cantonal Hospital, Geneva, Switzerland, and the World Health Organization in Geneva, Switzerland. His work on injury prevention and control includes research on violence against children, women, and youth, alcohol abuse and injuries, transportation safety, burn-related injuries, and occupational injuries. He has written several peer-reviewed publications, book chapters, and policy documents addressing violence prevention, injury surveillance, and prevention of unintentional injuries. We are so excited to have Andrés here with us today for this wonderful presentation. Thank you.
Well, thank you very much, Kelsey, and it's really nice to be with you all here. The presentation that I'm going to go over with you all is intended just to share a process that we have been applying in a variety of countries. In this particular case, I've selected a few examples from Latin America, but indeed we have done this in many other countries in the African continent, in Eastern Europe, in Southeast Asia. So we've learned over a long period of time of doing this over 20 times. We've learned a few lessons on how to better work on these particular issues and how to collect information where there is none, for example, and then transfer all that information into effective policies that actually end up benefiting the populations for which we are working for. So what I want to do in this particular session is just share some of the lessons learned, give you a little bit about the context so that you understand this. But I want to use these experiences also to connect to what you do in Connecticut, what you do in the different areas that you work with, and not only areas from a thematic perspective, but geographic areas or subpopulations that you work with, etc., or the specific issues that might be of interest for you. So part of the discussion and the sections where I will stop and engage more in discussion with you is rather than ask, it's more to understand a little bit what you do and to connect some of the elements that I will be presenting to perhaps similar elements or similar activities that you already do. What I want to convey here are some principles, but there are principles that have applications in a variety of settings. So I'm going to share my screen. Here we go. Okay, and okay, I think you got it in. Okay. So let me know if you have any trouble, seeing any of these or understanding any of these elements that I'm going to talk about. I'm going to focus on the cross-sectoral collaboration and experiences that, but we can draw from a variety of other experiences as we move along. So this effort in this presentation, what I want, and these are some objectives that your colleagues came up with and that we discussed previously. We want to recognize the importance of cross-sectoral partnerships in collecting and using sexual violence data in this particular case. I'm going to maybe in some areas highlight other forms of violence, that they are very much interrelated in some cases, broaden the understanding of effective sexual violence prevention activities across a variety of spheres and in the socio-ecological model. understanding applications for the lessons learned from the implementation and responses to this very specific surveys, mostly focusing on Colombia and Honduras, but highlighting other lessons learned, and identifying strategies on how communities could develop sexual violence prevention action plans. And translate that into policies, into actions, and measurable outcomes at some point. So cross-sectoral work is really important, and it's really an infrastructure for collaboration. Cross-sectoral work really helps when you identify common objectives. It helps working with different people who have a common objective or goal, who want to achieve something. But many times, because of institutional setups, because of a variety of contextual settings, sometimes are not in adequate communication. So identifying those common objectives and working with these different sectors is really important. It's important for data collection procedures and for data quality. Information on violence, on sexual violence, on violence in general, is extremely important for its quality, for its completeness, to be collected in a cross-sectoral way, because different sectors, different institutions collect different types of information that are useful for us to understand what is going on. Health authorities can collect information in some settings. Educational authorities can collect information in educational settings. At the community level, the police or other community organizations can collect information. In digital venues, we can collect information of a different quality, et cetera. So working with a common objective, but around a series of activities that incorporate all the elements of sectors is extremely important for getting better data, for understanding the context of those data, and for improving the quality. But it's not only there, we can't stop there. We obviously have to use those data. So interpreting it, getting everyone from different sectors, from different paths of life, from different disciplines, from different experiences to interpret those data and understand, perhaps have some priorities is extremely important. And once those priorities are set, then that can help at different levels of government or even community organization to set up a series of actions, be them policy-related actions or actions at community levels that can actually effectively have a benefit for the populations that we are working for. And of course, monitoring and evaluating what we do so that we are sure that what we're doing is going in the right direction. So these are the 5 topics that I'm going to sort of talk a little bit about throughout this presentation with you, and develop and just tell you how we've done this overall. The first one is identifying common objectives, and so we work at an international level, and we work with several countries. To have a common approach, we've actually created an infrastructure under an umbrella organization that is called Together for Girls. And this is a private-public partnership where, as you can see below, a series of organizations and countries, the government of Canada, several agencies of the United States government, United Nations institutions like UNICEF or the World Health Organization, or UNAIDS or UN Women, or the United Nations Fund, Population Fund, have joined together with also some private entities on a common objective, which is ending violence against children. Our efforts and the Violence Against Children surveys, which is a tool that we use to actually inform what's happening in the world so that we can do something about it. These efforts are under this umbrella, and there's a common objective to use this information for action, to use this information for the benefit of the populations that are affected by this problem. So we have an international structure, and then we approach countries, and within countries, as we collect the data, we also have a country level infrastructure. So we typically have and work with a multi-sector task force. this cross-sectoral work is extremely important. So at the national level, and I will be talking a lot about national level, but I want you to start thinking how this can be extrapolated, for example, at the state level or at the local level. That many of these levels of organization can actually be implemented, and there are some good examples also, for example, in the city level, led by a mayor, by the mayor of a city, or led by a particular entity in the city. They could be applied in a county also. So the type of leadership and the verticality of where we put this can be adapted and translated. What is key here is that to make this work in an adequate way, it really needs to be cross-sectoral. And we have a guiding agency because we work with national governments. We typically discuss with governments that are interested who would be a leader agency. Typically, they are ministries, and they vary a lot. In the case of Honduras, for example, we work with the Ministry of Security. In the case of Colombia, we work with the Ministry of Health. In other countries, there's a Ministry of Women. And so ministries, the equivalent of the US departments, so DHHS would be the equivalent of the Ministry of Health in a particular country, and then we would be working with different agencies there or different units. We have a series of international agencies that support us, and US government agencies. There's elements of support, technical support. At CDC, we do a lot of the technical support on how to do these surveys, but we have also financial support from either international or national agencies. And then we have a lot of additional support that helps us contextualize whatever we're doing to the different settings where we're doing this. Doing a specific survey in the cultural context of a Central American country like Honduras is very different than doing it in, for example, Moldova in Eastern Europe, or in Cambodia in Southeastern Asia. So obviously, understanding the cultural and the organizational nuances are important. And so understanding our context is really important to set up that infrastructure. Who is the best to lead, and who are the best partners that we want to have? As an alliance, you already have a history and that has organically and developed around a common set of interests. And so that's important to have that, because that's already a strength that is guided around perhaps a common objective, but also with potentially some differences that are related to topics, to context, to populations, etc., that might vary. We use this organization and this information as an advocacy tool, in a sense, to highlight the problem, to break the silence about a problem. In many of these places, information is insufficient or non-existent at all. And so we want to actually bring it to the attention of societies to start a new conversation, but always to go to that final point, which is create action. And so that's really important in the process that we do this. This complicated slide is just to show you that we have a process. And we typically follow that process. And all those little dots are different agencies and different sectors that collaborate at different stages of the development of a survey. On the technical parts of the survey, this is a very technical sort of process type of diagram. We need to engage the country. We need to set up that infrastructure that I just showed you. We need to mobilize and entice the different agencies to participate. And of course, later on, we need to implement the survey, which needs to be adapted, reviewed ethically and methodologically. Then we collect the data, and then we present back the data to the different authorities of the country and discuss the implications of those data and those findings to create a series of priorities or recommendations on where to focus to eventually lead to the final step, point 7, which is develop a national action plan. That's what we want. Obviously, we're working on a national level here in many of these countries, but this could very well, the same process could be very well done. And in fact, sometime in the future, it might be feasible that we do it in a city. And right now, we're actually piloting this type of approach in the city of Baltimore in Maryland. So we're working at a very different level. It's not always a government, sometimes it's a city government, and then coalitions or alliances that we might have there. It's really important to understand this process. What it does is it helps us create that infrastructure, but from the get-go, ensure that we are working with a series of key actors that come from multiple sectors that will be invested throughout this process and that will be benefited by the findings. And those findings will presumably in the future modulate their activities and their efforts towards addressing a problem. So we have agencies within the justice system, the health system, the education system, child protective services, et cetera, that have their own specific mission and role, but that this mission and role is going, and the findings from these data are going to be useful for them in one way or another, as a single entity or in a collaborative sense. Just to highlight the same diagram here, we have very specific multiple partners here, other partners or multi-sector task force. And so the dots that are highlighted other than gray are parts of this process where it is key to actually get input from our cross-sectoral collaboration so that our data is better, our data is collected in a better way. It addresses the issues that are of relevance to the different institutions, but that it is used by these institutions in a later stage. So let me stop here and let's talk a little bit about what you do in the Alliance. So what, if anything, can you tell me, or how do you see, you're obviously an Alliance, so you have a structure. Who participates in the Alliance? And these are just questions, mostly questions that I have that you probably know way better than I do, but that I just want to discuss a little bit with you in terms of infrastructure. So how do you work? Do you think, for example, that as an alliance in Connecticut for ending sexual violence, the way you are working currently, do you have all the partners that need to be sitting on the table, or do you think there are more partners? So I'll stop there and I'll let you guys, let me know what you think.
And folks can feel free to put stuff in the chat. I'm keeping an eye on the chat to give, I know we have one question there. Lori, that's a great question. I will give that to Andres once we talk about this piece a little bit. Or feel free to just unmute yourself and share.
Well, it's one of the things that I just want you to think about is, does the Alliance encompass all the people it should encompass? Could the Alliance be benefited by other sectors participating that are not participating? And if they're not participating, why are they not participating? Are they certain barriers? How could these barriers be overcome? What benefits would other institutional participation or other groups within communities bring to the Alliance that might benefit the Alliance? So those are really important questions. Why don't we look at, I can't see the chat, but let me see if I can actually, I can.
Andres, I can try to get us started. One of the things that we've been talking about, and maybe Kelsey and I mentioned to you, maybe not, but we, so the way the Alliance is structured is that we are an alliance of sexual assault crisis services centers, right? But almost all of our crisis service centers have different community partners that they regularly work with, right? So we don't always formalize those relationships in a kind of multi-sectoral approach necessarily, although it'd be really great for some of you to speak maybe to the MDTs, the multidisciplinary teams that you work on, when especially addressing violence against children, sexual violence against children. But one of the areas that Kelsey and I have really been focused on, and we're going to work with the membership on, is bringing in public health as a specific entity that we think is really critical to be a more active partner and player with the Alliance and its members in terms of really trying to address the prevention side of sexual violence.
Excellent, and I think that's that's super important. It's, we obviously, when we work with other states, other national states, it is typically really important to formalize things, to get some commitment, etc. Sometimes at a more local level, formalizing those collaborations is not that necessary because they organically work and they work. But if needed, sometimes it's important to do that. I think one key thing of bringing and having a multi-sectoral work is to understand really who could, from their different sectors and from the institutional perspectives, bring something to the table that is beneficial for ending sexual violence in the state or in a particular locality. Who are those agencies? Who are those institutions that might bring some benefit that might not be in a specific region or a specific area of the state involved? Could they bring something else? Sometimes it could be just funds. Sometimes it could be, some technical work. Sometimes it could be just easing the transition of some actions, linking different sectors, health responses with child protective services. I know in the United States, we've been working a lot, and now in the context of the pandemic, to understand a lot of how people are affected in terms of sexual and physical and emotional violence in the home. And one of the findings that we have noticed throughout the United States is the siloing and the disaggregation, the lack of connection that there is, for example, between child protective services and healthcare institutions. And so there are opportunities to link this to ease the path of people and to facilitate preventative activities, etc. So these are important things to consider. I will continue my presentation, but what I want to do in these different sections is just to come back to Connecticut and have you think a little bit about the different elements that I'm talking at the international level, but think of them at a local level or at a state level.
So I kind of, when you initially asked the question, I thought of answering your question with another question of like, how do you know who's missing? But as you talked more about it, it just, especially when Jesse brought up the MDT teams and all of that, it occurred to me that maybe having, I don't know if a lobbyist or just a politician be involved in these meetings to understand what's really going on the ground and how everything really goes down, I feel like would be beneficial, but I don't know if it will be possible.
Well, that's a really important point, and that's something that I will show you a little bit ahead, how engaging certain political authorities can either make or break some of these issues in terms of action. We can collect a lot of information, we can do the technical stuff, but what if we just end there and then nothing happens with that information? So your point is really key. Could you have someone, even at a local level, many times, and there are multiple examples where support at the policy level and demonstrating that it works at a local level has actually enabled a single experience to be scaled up or replicated in other localities and then scaled up vertically. So we don't need to start at a state level and go down. Many times, and there are many examples where we can start multi-sectoral work at the local level, prove that it works, and then replicate that and let it go up. And so if that type of leadership or policy support can be elicited initially at a local level, well, why not start there? If it works at the state level, fantastic too. But it's really important. So I'm glad you bring that political participation, because that's a really key element to actually engage in change and setting up a framework that might be more beneficial for the activities that you do and ultimately for the populations that you serve. So excellent point. Do you want to address the question, Kelsey?
Yep. So there is one question in the chat, but also I think to what we're talking about right now, some other folks just added the importance of just like community members and sort of the general public having awareness of what's going on and being involved, whatever opportunities we can give people. And then there was a question related to, I think earlier when you were showing some of the process, what it looks like. And someone asked, how long does it typically take to get from step 1 to step 6 or 7?
That's a really good point. It varies a lot. There are countries that are easier and others that are more difficult. But typically the process can last about 3 years. On a fast year, sort of 1.5 years is really fast. Some have lasted longer for a variety of externalities. Sometimes it's a pandemic, sometimes it's a war, sometimes it's things that we have no control of. But I think it's a process that is initially medium-term process, is not short-term. And that medium-term process is because we have to, a great chunk of what we have to do initially is set up that multi-sectoral work and that organization and figure out what is the best structure that might work in this place. Once we start the work properly, once we agree, okay, we're starting here, then that process can take a year or a little bit over a year to collect the information, to analyze it, year and a half. And then once we produce a report, then a longer process, which is the policy component, starts, and that process varies a lot. And it's affected many times by external things. So it's really important that in this multi-sectoral work, this is why it's important to have people that are committed, but also benefiting from that information, because it can go from mid to long term. And it's obviously, if we want to reduce this problem, we want to be thinking 5 to 10 years, where are we headed? Where are we going? So it's always important to have that and to understand that, in our particular case, for example, political administrations changed. And so we need to account, okay, what are we going to do when this new president or administration or different party comes up and starts governing in a different way? How are we going to make this an issue for the country and not an issue for a political type of administration? And so that type of information is really important. On the community part, super key. I think that's an incredibly important point, is to have community buy-in, to have community participation, especially when we're working at the local level. We have good examples in Honduras where actually, and in very specific municipalities that had very high rates of violence, it was the community that actually mapped their own municipality, like really literally geographically mapped it and identified the community assets that they had. And they used that community knowledge and collection of information to inform the mayor's office so that they could create better programs for violence prevention. So community participation is always extremely important. The community understands why and how things are happening. And while doing a survey can tell us how big and where and who, it doesn't tell us why and how. And so understanding that context is really important, and it's typically the community that can give us that information. So excellent point. I'm going to continue now with some other components. So data collection, procedures, and data quality. Cross-sectoral work is super important, as I mentioned, in violence, prevention work, any type of violence, justice, health, education, child protective services, many different types of agencies, sectors, people, and disciplines collect information that can be useful for us. And we need to capture that information to understand better what to do. The surveys, as I told you at the beginning, we've done in multiple countries. We're doing some right now, some in very difficult areas right now. As you can see, for example, in Ethiopia, right now we're a bit stalled because of the civil conflict. But we have worked in countries like Colombia, where there has been an ongoing civil conflict for a long time, or countries like El Salvador or Honduras, where there's a high presence or prevalence of community violence in urban settings that makes it challenging. So it is not impossible. It is challenging, but it is possible to do this. And I have Baltimore there as a little star because we're working locally on Baltimore, in Baltimore, trying to understand. We're piloting right now AVAX so that we can actually eventually implement and know more about what's happening in our own country. These are surveys, the VAX that I'm telling you, they're national surveys that actually ask questions about violence to children, 13 to 24 children and youth, and they're carried out by country institutions, and we do a lot of training to actually collect that information. And we ask about a variety of topics: physical violence, sexual violence, emotional violence, all the topics that you see on the screen. What is key here is that when we are going to implement, or when we arrive to the country, we have a series of core questions, but all questionnaires are actually put and shared with a multi-sectoral group that actually tells us, okay, you need to change the language like this. You need to ask these questions because this particular form of violence is important in this country. We obviously have to adapt it to their census or administrative classifications and local classifications. So we work, and these are so the tools for measuring and capturing the data are also informed by these multi-sectoral groups. And that's why it's so important. Common objective: share the tools, share what you're going to measure with everyone so that all that information, be it either informed by communities or by other sectors or institutions, is actually captured and understood so that when you collect the data, it'll respond to the needs and the priorities that that particular community has. So that's really important. What do we find? So I'm going to show you just some findings, and I'm putting in the red arrows just the ones that pertain to Latin America and the Caribbean. But you can see that obviously globally there's a wide variation. This is the prevalence of experiencing any violence in multiple countries. You can see countries like Zimbabwe have very high rates, and then some that report lower rates. Incidentally, that one that reports the lower rates, these are rates that are told to us by males and females who are survivors. But El Salvador has the highest rates of fatal injuries. And so contextualized, it can mean different things. If you want to go more specific, then we ask also about sexual violence. And what we see there is that it's a problem that affects both males and females, but much more females than males. And again, in different magnitudes of order in different countries, but equally important. And so we start seeing some similarities and some differences. If you look at physical violence, it's more prevalent overall than other forms of violence. But in some countries, it is females, like in Haiti or Honduras or El Salvador, it is more prevalent amongst females, while in Colombia, for example, physical violence is more prevalent against males. And so you start also seeing some differences in populations who identify as males or females. And emotional violence, again, we have high presence of emotional violence, and mostly also affecting females relative to males in this particular setting. We can look at aspects or consequences of emotional violence, and then we see that some populations, when they are exposed to violence, they have a considerably higher components of consequences for mental health, etc. And so the exploration of this data produces new information that can actually start to guide where is it that we need to go, what type of violence we need to address, or what are the consequences of those violence. From a service perspective, for example, we know in the 3 countries that I'm showing you there, that a lot of people, when they are subjected to, I put the example of physical violence, but sexual violence looks virtually the same. When they're exposed to physical or sexual violence, they tell someone about it. More than half of the people tell someone, I was victimized by X or Y, someone they know. A smaller percentage of people know where to go. A little bit under half of the people in these countries know where to go, what to ask for. But then when it comes to seeking that help, it drops to less than 10%. And then getting that help drops to less than 5%. So what we're capturing in a surveillance system or in a system, an administrative service that is, for example, captured at the state level or at a city level, is only that 5%. And it's really, we're missing 95% of what's going on. So doing a survey and incorporating a series of other actors that participate in the survey is going to improve us, our quality of data, the completeness of the information, and is going to tell us and give us a much better picture. So the sources of information, the type of information that is collected is really essential to get a better picture of what's going on. And this is where the participation of multiple sectors is really crucial. So let's go back to Connecticut. Do you use data that is officially produced at the state level or at local level? What are the sources of those data? How do you know it's good data? Or how do you know it's complete data? And do you participate in the analysis or summarizing those data? How do you use it? How do you disseminate it? So that's a question for you all. So let me stop here and let's engage in discussion again. Who wants to tell me a little bit about that?
So in the chat, somebody mentioned ETO, which is our like internal data collection that we do, that all of the sexual assault crisis centers that are here today, folks put in information. You all know more about ETO than I do. All of our advocates who are here today, but folks put in information about who is coming in to receive services, what kind of services they're receiving. They put in demographic information about the age that somebody was when they experienced whatever form of sexual violence they did. There's a bunch of different fields that people are completing. And then at the Alliance, and folks may be doing this individually, like within your member centers or within your agencies, like looking at, okay, what, who did we see in the last year? What does all that data look like? And that definitely at the Alliance, we have people that are looking like across the state, what do all these numbers look like, and where are people coming from? What communities are represented here? Things like that. So that's, yeah, one source of like very local data, just of utilization of our services.
So you capture the data and you look at it, locally or at the state level. Do you do anything with the data other than look at how big the problem is? Do you send it somewhere or link it to activities that are done in relation to prevention or response about these victims? How is the information used other than collected and summarized?
Well, if anybody from a member center wants to, if you all are using ETO or looking at I'm curious to hear like how folks are using ETO and if it's informing the work you're doing. And Jesse, you can probably answer better than I can in terms of what we do at the Alliance with it.
Yeah, I'm happy to share that, but I'd love to hear member centers share if any of them are using their programmatic data to make decisions first.
I know our center, and I'm not the person in charge of all the data, but as far as I know, a lot of it is used mostly for funding. I don't know if it's used for taking action in one way or another. I would have to find out about that and get back to you.
Okay, well, you bring an important point for funding. That's super important. It's a perennial problem that exists everywhere in the planet. There are not enough funds to do a lot of this work. And so it's important to understand, well, and this is another area where you are using this level of information to actually elicit partnerships in the sense of potential funders that might help you, either coming from the state level or federal or local or private sources that might help you address some of the needs. That's important. It's extremely important. Another way of using information is to actually, obviously you can summarize it, you can understand what's going on, is to identify, okay, what are the most salient, what are the most important problems that we have, and what could we do about them? And so it's transitioning to that part of action. And I want to highlight in the next part a little bit of how we do that with the collection of this information. So transitioning from data to action. So once we collect the information from this country, it helps us, we need to interpret the information and set a series of priorities. This is one of the most crucial parts where cross-sectoral work is relevant, and participation of different sectors and different perspectives is important because it helps us understand who is collaborating with whom, who is doing what. But before that is, let's look at the summarized data and see, well, what's our biggest problem in this particular setting? And if we, different sectors might have different priorities. So what we do, and I'll show you how we do it. In reality, different sectors have different priorities. And so you come up with a series of multiple recommendations where you can take a series of actions that can inform either policy or the implementation of interventions that are aimed at prevention or controlling or reducing the problem that we have at hand, sexual violence or physical violence, et cetera, et cetera. So once we collect the data, we present it back to the countries, and we have done that. We summarize that, we produce what are called the priority indicators of the data. So we summarize that information and we produce a type of fact sheet. And then we sit down with different sectors individually. We sit down with health and show them the data and ask them, well, what do you think? What do you think is the most important thing here? And then we get some information from them on that, their initial reactions. And we do that with other sectors, with child protective services, with justice, with the educational sector, et cetera. And so we get that information and we capture it, and we actually ask them a series of questions. Not only what do you think about the information, what do you think is the most important part here, but also who do you collaborate with? Who do you collaborate with? If you're in government, within government. If you're outside of government, who do you collaborate outside of government with? Or who do you collaborate internationally with? Who's supporting you? Who's giving you money? What type of interventions do you have? So we start documenting that, but this is an initial process of understanding this landscape of collaboration that exists around this topic so that we can transition and we can actually do this in a more systematic way in a workshop that we call a workshop of data to action. It's a 4-day workshop where we basically sit down with the different sectors. We group them into different tables. Here's the table of health, here's the table of education, et cetera, et cetera. And we present the different modules of data to them. And then we ask them a series of questions, and I'll just go over with you a series of questions. So we're going to look at an example. So here's a country, and the country has a series of indicators here that address physical violence, that address sexual violence, emotional violence, services, consequences of violence, like the mental health consequences, witnessing violence, a whole variety of topics. There are about 30-something different topics. And we attach to them a summary. We have done, the previous days work with them, presented the data in more detail, have them sort of understand it, digest it a bit, ask questions about it, really get acquainted with all the findings. We then summarize it like this and present, okay, amongst the youth 13 to 24 who identify as females, we sort of put, this is the prevalence of the information, and this is for males. And so we provide that information to the people so that they can start thinking about, okay, what is more important for us here? Child protective services might have a very different approach than the educational sector. They might think, well, I think number 1 is more important than the rest, and the others might think, well, number 10 is more important than the rest. But that's the type of discussion that we want to do, because, and so we ask each sector independently what they think. So the idea is to define those priorities so that eventually we can map it to specific interventions that we know that work, so that we can recommend types of interventions that we know that work to solve or address the problem that we are looking at. And it also helps us define, okay, well, if we need to implement this, who's going to pay for it? Who's going to be in charge of it? What is our time frame to determine, okay, we're doing the right thing or not? Who are going to be responsible about this? And so that's when we transition from those data to recommendations, and those recommendations will inform what we call a national action plan. This national action plan could be done at the state level. And I'll show you actually an example. The country of Colombia actually decided, no, we're not going to stop at a national action plan. We're going to do 32 different state level plans. And so they decided for the entire nation, each state is going to select, or the equivalent, they're called departments there, but each department is going to select and define a plan based on their priorities. It's a big country, so has very different populations, different priorities, different issues. And so they're doing that. I'm going to show you how they're doing it. So let's say the social service sector decided that corporal punishment and physical violence by a caregiver are their biggest priority. So we typically go through a series of exercises where we ask them, select 3 priorities and write a desirable, sort of measurable objective of how you want to see this problem reduced in a series of years, a period of commonly agreed upon timeline. And so we do that, and we help them define those objectives and select that priority. Once we do that, let's say a sector selected any sexual violence against any perpetrator. They consider that 16% sexual violence victimization against women and 10% against men is completely unacceptable. And then norms and values around beating, wife beating, or harmful gender violence and sexuality norms are completely unacceptable. And so they decide to focus on that. And so based on those indicators, we can say that 1 out of 6 females, 1 out of 6 female youth and out of 10 males are actually experience sexual violence by any perpetrator in the youth, and that's unacceptable. So that's one of our priorities. One sector selected that as a priority. Another sector or the same sector might have said, okay, norms and values, we're really worried about this because, a fifth of our population, of a little bit over a fifth of our population of males and females actually would justify under some conditions wife beating. And among the older populations, more than half of males and 2/5 of the population of females endorse harmful norms about gender violence and sexuality. So with this data, what you get is sectors addressing what they think is most important. And so I'm just highlighting, assuming in this example, they selected these. So how do we select interventions? What we have is we have a type of framework that is called the INSPIRE framework. And this is where organizing, it's a framework that helps us organize a series of actions, a series of strategies. There are 7 strategies, and I'll show you which ones they are in a bit. But those strategies are used to actually identify interventions that we know work and have worked in several places in the world. So they're evidence-based. And so we want to actually sort of recommend that type of intervention for a particular country so that, because we know it works, it'll help that population eventually. So let's say they selected the justification, the norms, the harmful norms question, and that has typically in our mapping, we have a mapping tool, and that tool is linked to a variety of strategies from a document or a framework called INSPIRE. As I said, I'll explain. And then each one of those strategies is linked to a series of programs that you can see here on the screen on the right-hand side of your screen. So these are actually specific names of programs that are described. And so they're types of programs. Some are parenting programs. Some are related to legislation. Some are programs that are implemented in educational settings. Some are programs or strategies that modify norms and values in the community. So this topic 14 that addresses norms maybe this community mobilization programs around norms and values is going to be super important for this country to implement because of those harmful norms that exist in that particular setting. And so as we transition from the data, we are mapping it to a series of interventions that we know that work. And this is a tool we have created around a document that is a technical package that was created. One could envision creating similar tools for any topic for sexual violence. You know, one could envision, okay, what are the data on sexual violence and how can we prevent sexual violence under a variety of interventions that have been applied in the United States that we know work in the United States? What are those interventions and how, based on a particular indicator or set of indicators, could we map this? So that's more or less what we do in that process. That guide, that what is called Inspire, has 7 strategies. And strategies that are based on passage, enforcement, and implementation of legislation, modifying norms and values, creating safe environments, either physical environments in the community, producing safe environments in the school, creating safe environments in institutions, in workplace settings, parent and caregiver support. So we work a lot also on supporting parents in positive upbringing of children and positive positive parenting strategies. Income and economic strengthening, really important. It's being shown in many places that supporting families that are at risk or that are more vulnerable actually helps them a lot. And now in the context of the pandemic, that's become really, really relevant here in the United States. In some populations, in minoritized populations especially, have been really, really struck hard by the pandemic from an economic perspective, access to services, access to education, to work. And so this type of support might be important. How can we improve response and support services? As I said at the beginning, here in our own country, we have services that are not typically linked in the ideal way that they could be. And so child protective services don't always talk in the best way possible with health services. They're completely disaggregated. And so it's very difficult for a person in the community to actually know where to go. Do I go to the police? Do I go to a healthcare unit, or do I report this to child protective services? Do I go to a rape center? Where do I go first? And sometimes navigating this is difficult. And it's made more difficult sometimes because if I cross a state line, it might change completely in a different state. And so it's really important to understand that. And of course, in educational settings, what is going on? What is going on in universities? What is going on in schools? What is going on in educational settings that can be improved? So these different strategies help us address the different topics and provide a framework that we map so that it's easier for us to identify those solutions and those interventions. And then what we do at the end is we basically summarize. This is a summary of the different sectors. So you can see, okay, all the international agencies were sitting on a table and they discussed all the data and they mapped it to the different strategies. So they determined that the first priority was physical violence for this country. That coincided with the education and the justice sector, but the education sector thought that this was their second priority out of 3, and justice thought this was their third priority out of 3. And if I look at justice, okay, justice's first priority was use of services by sexual victims of violence, which also coincided with education. So it's a summary tool where in the process of that discussion of this workshop, we actually get, okay, how are people thinking about this process? How are they prioritizing it? Which are the common areas that they are identifying? So obviously you see that there is coincidence, sexual violence here, norms here. These are very, very, very important areas where we can intervene and where several sectors identify them. And then we map them to those Inspire strategies that I had shown you. The idea of mapping them is just to help us organize what are the interventions that might be linked to this. So what can we do about this problem using each one of those strategies? So from a legal perspective, are laws protecting women is the legal framework in the state of Connecticut adequate for protecting women from sexual violence? What is it missing? That could be a question. That could be an important, and there could be interesting answers there. The same could apply for, what are we doing in educational settings? What are we doing in the community? How are we creating safe environments for women, for example? And so this tool helps us summarize that type of information and produce a series of recommendations that we can then say, okay, based on those 7 strategies, the ones that popped up more for this particular countries were those related to norms and values, related to parenting, and related to education and life skills. So now we're starting to get a picture based on the data that what are the areas where perhaps we could recommend that a particular country focus a little bit more because they are more salient and more prevalent according to the perspectives of all of these different sectors who are participating in these discussions. So this is a summary of the input of each one of the different sectors. So let's go back to Connecticut. How do we set priorities? How do you guys, from a perspective of an alliance, how do you set priorities? Do you use information, data that you collect to set these priorities? Who participates? Are there a lot of differences in the state? East, west of the state, north, south? Are there geographic differences or subpopulations? Maybe some of you work with LGBTQI populations. Others work with other types of populations. Maybe some of you work with minoritized populations and some of you don't, or a mixture. What are the differences? So let me stop there and just get a little bit of feedback and thoughts from your perspective on how rich is your context.
One thing that I can think of, and I think I appreciate that. I think part of the point you're making with some of the the process that you're showing us right now, Andres, is sometimes it's just about who is ready to buy in to what we want to do and what are their priorities. How can, if we've got folks that are yep, I care about sexual, folks from a particular industry or community or whatever are saying, yes, I care about this, I want to do something like this, that we sort of just go with it, right? They're here, they're at the table. And so I think some of what, in this, the process you've been showing us, having folks identify their different priorities shows you where do you have the most buy-in or the most consensus around this is what we should do. So one thing that came to mind is currently the Alliance is doing some partnerships with breweries around craft breweries in Connecticut. And some of that came up because there was some, this predates me getting to the Alliance, but I know there was some social media attention on the issue of sexual harassment and sexual violence happening in breweries, right? Both potentially with patrons or, people that are just there, and also stuff, sexual harassment of staff. So because that was a really relevant issue and there was some social media attention about it, now the Brewers Guild in Connecticut is ready to be a part of having conversations about sexual violence. So that's what we're doing, right? So I think some of it is just when there's a particular issue becomes really, there's a lot of attention on it, then that sets the priority a little bit.
I'm glad you bring that point. It's super important, and that I can tell you in the case of Colombia, for example, one of the things that led to the country prioritizing so much norms and value changes around sexual violence was a very nasty event that occurred where there was a homicide of a girl who was raped basically and then killed. And this created national attention. So an event like that triggered a whole discussion and a whole response. And so sometimes it is circumstantial, and that's important. It's super important because it creates some momentum. It has, as you say, the brewers involved. Alcohol, incredibly important risk factor for sexual violence. So how do we address it? It is also important to think, okay, how could strategically we think, around this issue, how could we better involve these breweries, for funding, for participation, for training? So strategically thinking about including these different sectors is important. Maybe certainly the alcohol industry is very powerful economically and politically in many places. So how could we, in some type of partnership, get something that is for the benefit of the population to address this particular topic? And so those strategic alliances, yes, they come many times through situations like the one you described, but it's important to consider them. And we were not considering them before. Now we are. They're in our radar, maybe. How can we keep them here? How can we keep them involved? How could they help us strengthen the activities that we do in Connecticut based on their support? And so these are really, really key issues. Yes, they will have their priorities. They have probably a very narrow view of what they want to do because they're very circumscribed to cases where patrons or the employees are being affected under some very defined circumstances. So maybe it's not going to affect what's occurring in other parts of the community or in other types of institutional settings, but it's still an important aspect that can actually serve as a model of collaboration. And so one key thing here is to actually think about these opportunities as potential models of collaboration that can be replicated or expanded to other models so that our activities can actually be strengthened all the time. And so that type of strategic thinking is super important. And many times it comes from activities like the one you just described, which is, something happened, it was highlighted by the press, and now there's a discussion. Well, let's continue that discussion and let's not let it go. Let's use that discussion to affect a positive change in our population. So that's a really good point. The more people we bring, obviously, the more variety we will have in terms of perspectives, of activities, of priority settings, and perhaps of funding too. Maybe, it could come from other specific areas. So what we can transition to policy making. So once we have these priorities, we've recommended these priorities, many times what we find is an environment where every institution and every sector has their own issue. It's going in their own direction, sometimes in opposite directions, sometimes no clue. What we really want is collective impact. And so this is really important. That's why I reiterated at the beginning, having this common objective and this environment for collaboration where each one of the sectors or institutions can bring their own perspective and complement each other, that type of model is really a desirable model and can be elicited in different ways. What are key areas for achieving that? So have a clear logic model. In essence, have a good strategy, have a common strategy. Know where you want to get. How are you going to measure where you want to get? And what are you going to do to get there? The technical package is important. So have that framework that helps you organize your ideas, that helps you organize that strategy. And that's that INSPIRE technical framework that I was mentioning. Have mechanisms for monitoring where you're headed. Partnerships, super important. Probably one of the most important things is communication. Make sure you're in constant communication. If you perceive that there is a miscommunication, address it as soon as possible. If you perceive that there's an omission, address it in the most transparent way, because that elicits trust, and that type of trust increases the strength of partnerships, and it just builds on that common goal. And bring political commitment, as was highlighted before. If you can, try to identify a person who supports you politically, either a local level or a county level or at a state level. It's really important to have that support. INSPIRE, as I mentioned, has some strategies, those 7 strategies, and they represent best practices that reflect the best evidence there is, and they're based on certain criteria. What it does is just that technical package that helps us define. And we have that technical package is the framework that has the strategies here and some interventions. There's also a handbook that tells us, well, if you want to implement something in a particular locality, this is what you should think about the implementation. So it addresses how to do that. There's also a document that helps us monitor. And how are we going to measure the different aspects of once we start doing things? What should we measure so that we know we're doing things? And it has a guide to adaptation and scale up. So basically that guide asks questions. Okay, who should be doing this? If I want to expand an activity that I'm using in southwestern Connecticut to the entire state, but it's being used more in rural areas than in urban areas, or vice versa. What are the elements that I need to adapt? How do I need to adapt it to the different institutions? And so thinking about this is important. This is a technical package. What I'm trying to address here is that it's important to have a technical organizing principle. So what are your strategies? What is desirable to do from the perspective of evidence and prevention and control? How are you going to measure it? And then how are you going to adapt it? How are you going to adapt it to multiple settings? So we use this technical package to actually help answer some of those questions. Because what we want in the end is increasing all those 7 interventions so that the prevalence of violence against children will be reduced. That's what we want. Our ultimate objective is that. So in this technical workshop that we do this data to action, we create those important recommendations. But those recommendations are going to serve as the first step to create what we define as a national action plan. What should an entire nation or an entire city or an entire state do to address the specific problems that have been intervened? So it's typically a document that will be created that has some goals and objectives that are prioritized, that brings multi-sector stakeholders. It's always important to have all these different sectors that in any way have any participation in changing the situation about violence. They should be at the table. And assigning responsibilities, who's doing what on a specific timeline, so that a lot of duplication efforts will be reduced and we can maximize resources that are always limited. Multi-sector stakeholders, so we have community and civil society, we have justice, education, policy and finance, social services, health. A lot of these are government, but you can think of private sector institutions, super important. They have deep pockets sometimes, and executive sort of experience and commitment. So guiding that and engaging partners can be important from that perspective too, so that you can plan, develop, implement, and obviously monitor that plan. Again, just emphasizing the creation of a multi-sector committee is important. The definitions of priorities are important. Then once you define those priorities and you understand what is going on in the country, who is doing what, or what is going on in the city, who's collaborating with what, who's collecting information, who's doing what, then one can start thinking about, okay, what is it that we need to do? And once we define what we need to do, we need to monitor it and just say, okay, once we apply it, what is it that we're doing? So you guys have a lot of activities. You raise awareness, you do activities on prevention, advocacy, public policy, training, and you provide support. I took this from your website. So you can see that you act in different perspectives, in different contexts. For example, what do you do in terms of public policy? As an alliance or even locally, some of the examples, what do you do in public policy?
I can help answer it if others. So the member centers actually do a lot because they sit on a group of legislative kind of advisory committee for us as an alliance, and we have a policy person who works really closely with our entire membership, and then works to develop testimonies when there are bills that come up in the legislative session that we want to testify on behalf of or against. And so we put together sometimes talking points for politicians, or we put together testimonies that our policy lead reads or submits in writing.
Okay, so you already engage with people who have, the potential to elicit or affect change from a policy perspective. That's super important. You do advocacy. Advocacy is super important also because you bring, awareness. You talk about this issue. Talking about the issue is very important. Bringing awareness, that advocating for change after bringing that awareness is extremely important. How do you do that? You can do that through prevention. You can do it through support. But many times what we find, and this is something that I want to highlight, training. A lot of the things that we find is that many times we find that in these institutions we work with, there's a lot of desire to change things, but not a lot of knowledge on how to change them. So we have to do a lot of training. There needs to be a lot of capacity building with our partners and institutions that we work with. And that partnership helps individuals either in the community or potential partners. It helps them understand what the problem is through the training, but it also helps them as they get and they are more aware of how we can do things, they can have the potential to be more supportive and do their work even better. And so the combination of these 6 activities that I highlight here, at least the way I'm interpreting them, is extremely important. And using information and using the data, the size, the type of problem that you have at the state or local level is extremely important. What do you do on prevention? For example, what activities are you doing in prevention? Why are you doing some and not others? I mean, have you identified, for example, specific interventions that you know are helpful? Would you want to do interventions that are helpful, but you cannot? Why? Is it because of lack of money? Is it because we don't have enough people who understand how to do it? Sometimes, those identifying those issues is extremely important. And that's a little bit of what we do in this data to action component, is transition from the information to what can we do? And then when we transition to a national action plan is, okay, who should do it? How should we do it? In what timeline should we do it? So those are really, really important questions to consider and to answer. Just to give you a couple of examples, in Honduras, as I was telling you, the lead agency for the vaccines was the Ministry of Security. In Colombia, it was the Ministry of Health. We actually had in Honduras support from the president's office, and in Colombia from the office of the First Lady. The office of the First Lady in that country is very much dedicated and highlighted that her priority during this administration is the health of children, physical, emotional, spiritual health. So according to her, so that has actually helped us garner support from agencies within the government. The Child Protective Service Agency was assigned after we collected the information in Colombia. The government decided it is the Child Protective Services Agency that is the one who's going to lead the development of a national action plan. So they changed the lead at some point, but we have continued to work in a very cross-sectoral sort of type of activity. In the case of Honduras, what the Office of the President decided was like, no, we're going to create a multi-sector group, and that group is going to produce a plan that the group includes ministries, agencies. They will develop a plan, incorporate inputs from civil society, from academia, and then present the plan. The plan is done right now, and it hasn't been implemented because they just finished the plan, but it's being shared widely and with a bunch of inputs from a series of sectors. So coming up with a plan is really important in the sense that bringing up all these different opinions is essential to actually elicit an activity. At a local level, it could be potentially very easy. If you have, for example, if you're working in an urban setting in Connecticut and you have a mayor that is, she or he is very supportive of this particular issue, you could have a much easier job at actually getting the different sectors, you know, who works in the education or the health sector at the city level to help me address this issue. So in many times at the local level is actually easier. And that's where the rubber hits the road. A lot of times, that's where things actually are happening. So getting a good model of collaboration on a local level can be a really good example to actually replicate in other areas of the state and then replicate upwards, which is really important. Just giving you here a couple of examples. The country of Colombia decided to actually, in addition to the National Action Plan, as I mentioned, develop subnational plans at the level of states or the departments. So here's an example of what they did. And they decided to do a bunch of activities. They decided to actually do a capacity building course around Inspire because they wanted to the people in the government and different agencies to understand better what that framework is and how that framework can be used to implement or follow up, monitor interventions. They actually did a mapping of the programs that they have. They actually said, okay, what is going on this topic in this nation? Who's doing what? At least at a government level and at high level, they did a very good mapping and they identified 187 different interventions that are being done to prevent violence against children from a whole variety of perspectives and a whole variety of actors. They consulted with children and adolescents. So they actually presented the plan to them and they said, okay, look, we're working here. Give us your input. Kids, adolescents, youth, give us your input. This is really important. They did a seminar on how to adapt some of these interventions and scale them up. And of course, developed a national action plan and is in the process of developing 32 different, so imagine the US developing 50 state level plans to address sexual violence. It's more or less what they're doing. They added costing elements, so they incorporated finance and they added costing, some costing that comes from international agencies, some costs, the majority of the costs that come from the government's own investments. And they actually invited other countries to think about this Inspire model. And then now we're starting at this point the implementation of some of the evidence-based interventions. So they had to adapt that Inspire model to that Colombian context. And as you can see, they formed an alliance, National Alliance Against Violence, for Violence Against Children and Adolescents. So it's an alliance also. They created this alliance to actually work to prevent violence against children in the different context of the city, of the country. And so what they did is, you know, they created a plan and they sort of mapped the Inspire framework to their plan that has, you know, elements that are legal, social mobilization, risk reduction, care. And so they did an adaptation that more or less follows some of the principles of the theory that we had worked on, but now applied to an actual very specific plan. And that plan is focused on the lifespan of people, but it addresses, you know, early childhood to adolescence and to youth, the context of families, and it also addresses other issues like nutrition. And it has elements of prevention and elements of protection or response. So this comes out of this constant dialogue, and that dialogue, guided in part by the First Lady's office, but by most of the Child Protective Services Agency, is intended to advise the different departments or states on the measures that they need to take to actually identify partnerships or develop policy and programs. Again, efficiency, to promote efficient use and common objectives, and to guide and coordinate public policies. What they ended up focusing on, and so here's a multi-level type of approach that they followed. So they said, okay, At the level of the home, and these are actual programs that have been identified in that particular country. So parent and caregiver support, what type of interventions are key here to prioritize? At the level of educational settings, they start identifying different programs that work in higher education institutions, technical education institutions, or primary and secondary schools, or others. At the community level, what are we doing? So some targeted interventions, some capacity building in some different areas, and involving citizens, churches, faith leaders, community organizations, or leaders of the community to actually participate in some of these cases. They have gone all the way to involve kids and adolescents in the community to address issues around sexual violence or violence against children in general. Okay, what can we do at the state or overall national level? So how can we involve different institutions, the police, the armed forces, the private sector, international community, the media, civil society, and then come up with agreements with those different groups. So thinking about the national level. And then they also went to the digital level, the digital environment. Okay, we need to work also with internet providers, with telephone providers, with service providers, and to address. And this focus in this particular country is very much oriented towards changing norms and values around sexual violence against women. So one of the core priorities for this particular country is changing norms and values around gender and around sexual violence against women. And so they're working at all this level. So you can see that thinking about interventions, you can actually apply interventions. Obviously the individualized attention to persons, but all the way from the individual to the digital and social landscape is applicable, and it's doable and can be incorporated. This had obviously a planning process and came up with a national plan. And then it involved 32 different government agencies. So the governor's offices, the corresponding governor's offices of different departments, coordinated with different sectors. Imagine a national federation of states, or something like that. Civil society organizations, academic institutions, and then children and adolescents. So they included all this participation to create their national action plan. They found here 111 government initiatives, 49 from civil society, and 20 different interventions from the international organizations, all of which address different types of activities, some parenting, education, etc. And so this mapping exercise was really important to see who's doing what, who's collaborating with whom. And then they're following up the development of the state level action plan. So this table basically shows, okay, this state already developed 100% of this plan, and there are some that have developed very little, and there are different levels of development. So this is basically a table indicating progress towards the development of the state level plans. It's just the percentage of progress towards the completion of their plans that they want to implement. This needs to be mapped. Once the plan is created, a plan is mapped to as very specific interventions that were previously mapped. So those 180 something interventions are mapped, and then you determine, okay, we do the plan, we have some committee, we have identified these interventions, now we need to do something about it and measure. And so we transition to monitoring and evaluating those interventions. So the mapping that I was explaining to you, one of the first exercise was just that, and as I mentioned before, was to ask our multi-sectoral participants, who do you collaborate with? And created just this very, it's like a spider web type of image of who collaborates with whom, just to get a sense of, is there proper collaboration between different institutions? So we got information from several institutions, and this is a mess, but it basically shows in red government institutions, and each line is basically, we collaborate with these people, we do something with them. So you know there's a ton of collaboration already existing. What you want to do with the mapping is really get a sense, okay, let's go a little bit more in depth. And let's identify what specific, okay. And as you can see, there are some US-based academic institutions, for example, Child Protective Services is this one. They're working with UPenn, or they're working with Columbia University in New York. And so, you know, you get sometimes participation and information about this. What are they doing? They're doing this, that, you know. So we get a sense of the collaboration landscape, and eventually we actually map this out. And the summary of this basically shows us, okay, at the family level, these are the government interventions. These are non-government interventions. This is what they do. This is some of the aspects that they've achieved so far. And these are the institutions that are responsible. So you create this mapping tool at the community level, at the digital environment level, at the institutional level. And so we created this mapping tool. Once we had the priorities identified based on the data, we identify who collaborates with whom, then we identify the interventions, and then we map them out. We say, okay, what does this intervention refer to? What is the main focus of this intervention? So that we can map those interventions again back into the priorities of norms and values, for example, that we want to change. And now what we're doing right now, we haven't finished. In fact, by the mid-November, we're expecting results, is we sent this technical tool to each institution where we asked them a little bit more information about what is it that they do. Who does this? What are your objectives? What do you intend to measure? Did you already start? Are you planning to start? Who gives you money? Do you have enough budget? Do you have people who know how to do this? Or do you need people who know how to do this so that you can do it properly? Do you have political support? The idea of this tool is to get a better sense of the type of intervention that we're doing, but to also use the type of information that they're measuring as a monitoring and evaluation element that will be asked from them every 6 months, so that we know that there is progress, or that we know if there is progress or not in a particular intervention. And then we have asked in this latter part, one of the things we wanted to do is ask them about the quality of what they're doing. So in a sense, get a better sense, a close enough sense. Is it evidence-based, what you're doing? Or did you just come up with some wild idea and are doing something and maybe you're throwing your money away? One of the things that we want to do, obviously, is to make sure that the activities that are done are actually evidence-based, so that you're not throwing the scarce funds that you have away. And so we're using these tools. We will be evaluating them soon. And this will help us further determine which interventions are more based on evidence, so that actually people who are interested in funding will fund those interventions and will be likely to fund more of those interventions. So my last section, how do you measure progress? How do you measure success? Can the alliance further be strengthened? So could you envision some of these activities in the form of a plan be created in the alliance? Any takers? And I know it's a complex, difficult answer to come up with in a simple statement. So, what I just want you to think about is how you could maybe translate some of these activities. Could they help you? I think one of the important messages here is that these activities actually are adaptable. You can translate them to any place. They can be implemented and scaled up in a variety of settings. You can adapt them horizontally. For example, I'm doing something in County X. Could I do it in County Y? Is it feasible? Can I translate it like that? Or vertical adaptation. I'm doing it in a city. Can I expand it to the whole state or to an entire region of the state? Key always to understand better and to have that structure and process from a cross-sectoral perspective always present. This work, we have actually made it a requisite to do one of these surveys. It is obligatory to work multi-sectorally, to work cross-sectorally. It is obligatory because otherwise it doesn't work. It's not enough. And then create those do you have some guiding principles? Do you have some technical tools? And how can you translate that into action? So with that, I will stop here my presentation. And if you have any additional questions, I'm very happy to respond.
Andrés, I have a quick question. And you touched on this, so I'm wondering if you can expand a little bit on it. First of all, that was super helpful, and it just made me feel really good about some of the things that Kelsey and I have been talking about, hoping to do with the Alliance, because from your last set of questions, like absolutely, there's so much room for improvement and doing more and bringing in new partners and figuring out new ways to do things. And there is a statewide action plan for prevention that predates probably many of us that the State Department of Health worked on, I think, with the Alliance many years ago. And so we're hoping to revise and update that plan with more input from our member centers and local health departments. One of the things that you touched on really early on in the presentation that you and Kelsey and I had talked about, I thought might be of interest to this group, is a little bit more about some of the cultural nuances in what you've seen. And I know that you've mostly worked on the VAX implementation in Latin America, but given how much you and your colleagues who have done work in other parts of the world, I was wondering if you could talk a little bit more about things that you've seen that are different and specific to the Latin American context, and specifically if there's like even differences between like what you saw in Colombia versus Honduras, and like where some of the different cultural components came into play for both implementation purposes, but also in like of the actual survey, but also in how the response is actually occurring.
Typically, I think linguistic differences are important. Sometimes, we've done some of this in different religious contexts. So it is really important to understand, in a country that has predominant religion might be very different from other. From the security perspective is also important. So from the perspective of implementation, adapt so that we protect the security of those who collect the data, but also of those who respond. So those are all adaptations, and each one of those adaptations has been instrumental to understand with participation of the local communities and agencies. Without them, we wouldn't understand this and we wouldn't be as effective. So the core is always the same, but that translation, either linguistic or either the approach that we have to communities or the way we approach the different governments is modulated by the recommendations of some of those leadership and those communities that participate. Yeah, that's extremely important overall. So understanding the context and being sensitive to it is of utmost importance. In Guatemala right now, we're working with Mayan indigenous communities. Has been extremely important to engage with them from the get-go so that they can benefit from this information. Yeah. Not in an exploitative sense, but rather use it for their benefit.
Great.
Well, I want to thank you all very much for the opportunity. I know we're over time, and some people have left, but I really want to thank you very much for this kind invitation. It's really been a pleasure to present for you today.
Andrés, thank you so much for being here. I think some of what you presented is in some ways really different from how we have thought about like approaching prevention or approaching, maybe, I know Jesse and I have talked about a lot of this, and we've done some other trainings in the last few months around what like a public health approach to prevention looks like, which is some of what you're talking about. But I think especially the collaborative multi-sectoral approach, I think it's a little different from how we have often operated when it comes to sexual violence. And so I think, I hope folks are walking away with at least like, even if we're just kind of like mulling over all the information because it's a little bit new. And the other thing I found myself thinking about was like, I was so happy to hear that you're doing a survey in Baltimore, because I was like, yeah, well, we've done, the CDC and like all the international agencies have been involved in implementing these surveys in other countries, but we really should be doing them in the United States as well. We are.
Yeah. Be creative above all. There's not a single formula. Adapt, but those principles of collaboration are really important. So thank you again very much. And it's really been a pleasure seeing you today.
Thank you, everyone.
Thanks
Okay,
everyone for
bye-bye.
joining us.